Lori and Andy, let's begin the debrief. My role as an instructor for this debrief is going to be to facilitate a conversation between the team, not necessarily evaluating you guys. Your role as participants in the debrief is going to be to ask questions, be open, and share your perspectives in a professional manner. There's going to be 3 phases of this debrief going forward. The first phase is going to be you guys telling me how the case went for you and sharing your feelings about that. The second phase, we're going to dig a little bit deeper and talk about the different clinical aspects of the case and understand how it ties into your clinical practice. And the third phase of the debrief is going to be summarizing key points and learning objectives for the case. For this case, the learning objectives were identifying when to wear PPE, the use of oxygen, and also identifying team roles and team communication. So I just want to start this by asking, how was that case for you?
It went well. The patient turned out all right.
Yeah, I think, we were able to identify the patient was in distress, and we put some oxygen on and he got better.
Great. So let's recap what happened with the case. We're going to use this to come back to later on and talk about a little more intricate details of the case. Can someone on the team give me a summary of how the case played?
Well, we were called to see the patient. We noticed that he was in respiratory distress. We put some oxygen on, he got better, and the family was there, and we kept the family informed.
And I'm curious about how the team decided the PPE precautions to take for this patient.
Yeah, I didn't see a need for any PPE. I didn't think we had any chance or risk of exposure, so.
Okay.
I noticed that the patient was coughing, so that's why I put gloves on. I didn't really verbalize that to Andy, and maybe I could have gave him a pair of gloves.
So, Andy, I noticed you had a concern about the patient's oxygen saturation. It was around 88%. Could you share that experience with the team?
Yeah, his SpO2 wasn't good. He was really short of breath. He was speaking in short sentences, and I was definitely a little concerned about that.
Well, I know the patient had a history of COPD, and I saw that it was 88. I was concerned about maybe using too much oxygen, because I know too much oxygen can, affect their breathing. And also, I didn't see what Andy saw because I was with the family.
I'm wondering if the team can tell me about the decision to not give oxygen in this case, and what drove that decision.
Well, I think I was afraid he'd stop breathing with high flow oxygen.
Okay.
That was my concern.
Sure.
Yeah, so as the family member, it was concerning to me that the patient, my father, was laying in the bed in respiratory distress.
So I'm just a little confused, and maybe Joe, you can help clear us up. I know in school and throughout we always hear about COPD and oxygen and how you shouldn't give patients with COPD oxygen because it can affect their breathing. But I know in previous simulations and in some of the more recent literature, it says that you should give oxygen to these patients when they're in acute distress and kind of help them level out and come out of hypoxia.
Yeah, so that's a great comment to make. Going back to what you mentioned about the literature, the most updated literature actually says any patient in acute respiratory distress or showing signs of hypoxia, we should give those patients oxygen. So just to highlight, that's a great point to make, and I hope the team is clear about that. So I'm also wondering what the family member felt as far as the patient care.
Yeah, so kind of like I touched on before, it was difficult to see my father there in respiratory distress. He was short of breath, having trouble breathing, but Lori was keeping me informed the entire time. She pulled me aside and was talking to me, making sure I was up to date on whatever was happening. And the whole team, both Lori and Andy, both seemed like they were in control. They had an idea of what their plan was, so that made me feel a lot better.
That's fantastic, great to hear. I'm wondering for Lori and Andy, if you were to go back to the setting in your clinical environment and you had a patient presenting like this, how would you maybe manage it differently next time?
I'd definitely use PPE next time. Definitely glove up and protect myself.
Okay.
I understand now that if your patient's in distress, regardless, use oxygen, high flow oxygen.
Great. So we're just going to review what we learned. This patient that we had was in acute respiratory distress, so I think we identified that we should give this patient oxygen if we were to encounter them again in our clinical environment. I think that we identified that we should wear appropriate PPE if the case calls for it, and you guys identified that as well. And the last thing we identified is the use of teamwork and communication within the case and how this applied to our patient and how you can apply it in future settings. The last question I have is, what are some takeaways you have from this debrief and from this case?
I'm thinking that we could have assigned roles. Andy could have been with the patient, I could have stayed with the family member, and perhaps maybe we could have huddled about the patient's plan of care.
You know, I learned I can use high flow O2 and with a patient who's got COPD, respiratory distress, and if I need to, I could just adjust the levels as needed afterwards.
Kind of really keep a broad view of what personal protection equipment you need, gloves, mask, gown, you know, and always just don't discount it for the patient's sake.
Okay, those are all great points. You guys have any questions about this case or any questions about the clinical care?
Not that I can think of.
Okay, fantastic. So I think we're going to move on to the next scenario at this point. Ready?
Yeah.
Yes.
Great.